All right. Good evening, everybody. My name is Jackie. I work for Medtronic, and tonight I have the pleasure of hosting this webinar where you're going to hear from Dr. Anuj Desai. Dr. Desai received his undergraduate degree with honors in biomedical engineering from Case Western Reserve University in Cleveland, Ohio. And he earned his medical degree from Lewis Katz School of Medicine at Temple University in Philadelphia, Pennsylvania. And he further specialized in general surgery and completed a urology residency at McGaw Medical Center at Northwestern University in Chicago, Illinois. And he then completed a fellowship in advanced robotics and urological oncology at Keck School of Medicine of USC in Los Angeles, California. Dr. Desai has a special interest in treatment of overactive bladder, and tonight he is looking forward to discussing that in more detail with you. So just a reminder, if you have questions, type them in that Q&A box at the bottom of your screen. It should say chat down there. And without further ado, welcome Dr. Desai.
Well, thank you, Jackie, for that introduction, and I thank everybody, the attendees for listening to this talk. I think, I think we'll get into some fruitful discussion on overactive bladder, certainly, and urinary issues generally, and specifically, we want to spend some time talking about a treatment that I have found, both through my training and my personal practice, has been very impactful on patients. And so what am I talking about? The bulk of what I'm talking about is overactive bladder. And I think the point of emphasis on this slide is just that you are not alone. Many people are suffering from overactive bladder. Frankly, I think the majority of people that have overactive bladder do not seek any medical care for this problem, but are quietly kind of thinking about the questions that you see on the screen. And ultimately, that does lead to, yes, significant quality of life disruption, but also disruption to the rest of their healthcare lives and, frankly, their social lives, as that trickles down into many aspects of what they're trying to accomplish every single day. I think the key here is just that it doesn't have to be this way. This doesn't have to be a normal byproduct of aging. If you have any of the following things on this screen, certainly if you urinate more than 8 times a day, if you're one of those people that's going to the bathroom every hour to 2, I often hear patients in my practice saying that they are planning their lives around the bathroom. They don't feel like they can just go to the Walmart and get through a shopping trip, frankly, without having to map out where the bathroom is. More than just frequency, it has to do with urgency, like the feeling that you have to go now, that you have to drop everything that you're doing to go use the bathroom. I think if you're monitoring your intake or what you eat based on your bathroom trips, I would define that as certainly on the overactive bladder spectrum. And then, more severe ramifications of this condition is people that have leakage because they frankly just cannot get to the bathroom in time. Or if you're getting up in the middle of the night multiple times and it's disrupting your sleep, certainly seek care for that. I think the incidence of overactive bladder, meaning how many people you're diagnosed with this condition, it's probably underreported, but some studies estimate at least 1 in 6 U.S. adults. That is, 43 million. Just people in the United States that have overactive bladder. And as I pointed out on the prior screen, the vast majority of these do not seek medical care and are kind of quietly suffering with this issue. We often group these things as both bowel and bladder dysfunction because the bowel and bladder are intimately related, both from a neurologic standpoint and muscular standpoint. I think, bowel dysfunction is slightly less common, but still quite common. 1 in 12 people, again, roughly 20 million adults, quietly have bowel dysfunction. And specifically, this is urgency, frequency, fecal incontinence, meaning loss of the stool. And also just, things can go the other way too. Constipation is certainly on that spectrum as well. I think the good news, from this is that there are treatments for this. I think many people, like I said before, kind of chalk this up to just a normal byproduct of aging, and something that they have to put up with as they get older. And that's just frankly not true. I think before we delve into kind of what we do as urologists and medical professionals for this problem, I think it's worth just going over some basic kind of pathophysiology. We say just how the body works with regards to these conditions. What causes bowel and bladder control problems? There are both kind of acquired issues, just from certainly from living. There are social and lifestyle issues that contribute to this. There are medications that contribute to this, or medical history. I think things that we tend to ask about on an initial visit is we just tend to ask about daily bathroom habits and how often people are going, what prompts them to go. Are there foods that contribute to periods of flaring with regards to the bowel or bladder, or do they not? Medications certainly have an impact on the bladder, as certainly everyone knows. Medications are not just seen by the intended organ, they act body-wide, and there are side effects of medications that can contribute to the feelings. I mean, I think a very common manifestation of this is I hear people that are on diuretics, Lasix, the water pill colloquially called. And I think that, I think the thought is just that, oh, I'm on Lasix and I just have to put up with going to the bathroom every half an hour. And I think to some degree, yes, there's some degree of truth to that, but there's also some degree of bladder storage and elimination function that can be improved by the urologist. Certainly, one's medical history with regards to pregnancy and childbirth, traumas, pelvic floor injury, prior radiation or therapy for prostate cancer or colorectal cancer, these things can contribute. And so that's just important for me as the medical doctor, the medical professional, to get a sense of. I think to really just kind of dumb down how the body works with regards to bowel and bladder, I think there's just really several components that are worth mentioning here. I think fundamentally, the way one stores and eliminates urine or stool has to do with a communication between your brain, down your spinal cord, to the bladder or to the bowel. And there are many areas of communication breakdown that can occur. And the therapies that are designed are used to either impact the muscle as it relates to the bowel or the muscle on the bladder. I think the novelty of the Medtronic system is that it really acts further upstream in the process, because fundamentally at the scientific level, what these conditions are a result of is it's because of an imbalance of communication between the brain and your bladder. And what the Medtronic system is designed to do is to retrain the signals as they process from the brain down the spinal cord to the bladder to better receive an appropriate signal that tells you, okay, it's time to pee, okay, it's time to store urine. These are conditions that I just want to throw out there because I don't want them to be necessarily confused with what we are talking about here. But bowel and bladder dysfunction comes on a wide spectrum, and I think it's important first for someone like me when I see you to get a sense of what exactly the problem is. And so there are a couple things that I'm trying to parse out when I see you. It's, do you have an overactive bladder, which is the bulk of what this product is designed to treat? And do you have incontinence, meaning leakage of urine, with regards to overactive bladder? Or do you have a completely different problem? And many times I hear people come into my office and they're talking about incontinence that's not with regards to urgency and frequency, it's with regards to what we call stress incontinence or wear and tear leakage. That's people that, they say they leak when they cough or they sneeze or they laugh or they stand up, but they don't necessarily have the urge to pee. And that's important to parse out. Importantly, urinary retention and prostate issues are a different kind of spectrum of disease from what I'm talking about here. If someone has a prostate issue, that typically refers to a blockage in the male urinary tract. And that is not what the Medtronic system is designed to fix. Now, certainly I have patients who have undergone prostate treatment and we remove the obstruction and they are better, but they still have some degree of overactivity in their bladder from years of having a prostate blockage. And that patient would be appropriate for discussion of this therapy, but not necessarily the standard patient that comes in with prostate issues. Importantly, I just want to add again, though, that I'm not just talking about the bladder. I am also talking about fecal incontinence. I think that's an undertreated area and an underutilized indication for this therapy. So again, just to emphasize, the bulk of this talk is emphasizing a product, the Medtronic system, that can be used to improve overactive bladder and incontinence associated with overactive bladder, and also fecal incontinence, urgency, frequency, and loss of the stool due to overactivity in the bowels. Just again to emphasize, I'm not talking about stress incontinence. That's if you leak when you cough, sneeze, laugh, you exert your abdomen. That is not what this therapy is designed to fix, although I see a lot of that and we have good therapies for that. The Medtronic system is not used for that purpose. Once again, just to emphasize, I'm not talking about folks with urinary retention due to an obstructive issue, and typically that has to do with the prostate. That is not what this therapy is designed to do. We've touched on this already, but just to kind of reset and kind of redefine what I'm talking about in this talk, it's overactive bladder. Again, this is urge and urge incontinence. The best way that I can put this is that you get the urge to pee so bad that you can't make it there in time. And so you are either leak or you are in near leakage. And then just folks that have just, very difficult to control urgency frequency. They're going essentially more than 8 times a day is a good number to know. Or if you go and you just never get the sensation that you're empty, you just always feel like you're incompletely emptying. Fecal incontinence, again, we've talked about this, but basically this is just not being able to delay the urge to use the bathroom with regards to having a bowel movement. Many times this can come in 2 flavors. This can come in urge incontinence, which is, again, you feel the urge, but you just can't resist the urge. Passively, folks can have incontinence with regards to the feces where you don't necessarily feel the urge to go, but it still comes out. This therapy can be quite fruitful for that. I think importantly, as a surgeon and as a urologist, I never tell people that there's only one therapy to use for any medical condition. And I think, we go down an algorithm for any patient that is coming to me for this problem, and we advance to more advanced therapies when they fail kind of the quick and easy ways to do this. And so I think it's important to just emphasize that there are lifestyle changes that I'll get into, oral medications that can be used for the bladder, and then more advanced therapies for this purpose when folks fail first and second line therapies, one of which is the Medtronic system that we'll talk about more in detail. Lifestyle changes are important. I think that these are underutilized by medical professionals and by urologists, but they can work quite well. Many people with overactive bladder can absolutely be controlled with diet. And, the classic things that I say to patients are that the gut and the gut, meaning the bowels and your stomach, your esophagus, these things have similar things that irritate them to the bladder. So we commonly tell people with overactive bladder, to moderate basically caffeine intake, alcohol, spicy foods, acidic foods, because we know that these have an impact on the bladder. And I'll tell you that I do have patients with mild overactive bladder that can be controlled in that fashion. I think exercise in and of itself does not necessarily promote clear overactive bladder resolution, but exercise is obviously good for your heart. I commonly tell patients that what is good for your heart and the rest of your body is commonly good for areas of the body that I treat. I think exercise with an emphasis on pelvic floor physical therapy, if you've ever heard of a Kegel exercise, or targeted physical therapy towards your pelvic musculature, techniques that they use are commonly called like biofeedback bowel and bladder retraining. These can be quite fruitful in patients with mild to moderate disease. A Kegel exercise is something that many of you probably know of, or certainly women that have gone through the childbirth process are probably educated on this. But the best way that I can describe this is that, if you were in the bathroom right now and someone walked in and said, "Mr. So-and-so, stop urinating right now," the muscle that you would kind of squeeze down in your genitalia pelvis to stop the flow of urination, working that set of muscles out, can be certainly fruitful for a variety of bowel and bladder conditions. Oral medications exist, and they've been out there for a very long time. And I think that they can be quite effective in controlling symptoms, again, in the mild to moderate patient. I think that one thing to know about oral medications is that they have to be taken continuously to work. It's not like you take a course of medication and then the issue goes away. These are Band-Aids for the issue. You take the medicine, it relaxes your bladder or bowel, and it appeases your symptoms in the short term. But many patients I have take these for a long, long period of time. Reasons that patients come off of these medications, and you can see on the screen there that there is a high rate of non-compliance with these medications, 72% in one survey. And reasons for that are, frankly, that the newer medicines that work well, that have a limited side effect profile, can be very costly because they are newer. And then the second reason is that the old school class of medications have unpleasant side effects or medication interactions. And so I commonly tell people to expect dry mouth, blurry vision, constipation, blood pressure changes. Now, certainly at lower doses, not everyone gets that, but these are possible. And there are data series that are out there that show that there may be more long-term risk of these medications than we previously knew a generation ago. And so I caution people about the idea of taking a medication every day for the rest of their lives, knowing that this condition will come back once the medication is stopped. Advanced therapies exist, and these are kind of what the bulk of what I wanted to get into is regarding. When conservative treatments either fail or they are just not practical for costs or logistical issues, then advanced therapies exist. And really, what I'm talking about with regards to bladder control as a urologist is I'm talking about the Medtronic InterStim system, which I will get to in detail, but that has to do with a bladder stimulator being permanently implanted in the back. There is the Medtronic Neuro system, which is stimulating a nerve that runs up the leg that can help modulate the bladder. And then there's injected medications into the bladder. And we're going to get through all these right now. And so the biggest probably, kind of medical competitor product to the InterStim, or just kind of the idea of sacral nerve modulation for the purposes of the bladder, is Botox. Botox, the way it works on wrinkles is it is injected into the wrinkle. Wrinkles are fundamentally a muscle spasm. Botox irons out the muscle spasm, thereby reducing the wrinkle. And we take advantage of this in a whole host of other areas in medicine, but we use it in the bladder as well. And it can be, frankly, effective for the issue of overactive bladder. But there are key reasons to why many of us in urology do not jump to Botox as our kind of go-to advanced third-line therapy, we call it. And again, in this study, in one of the studies, it was shown that 70% of people discontinue Botox after the first injection. So compliance is a big consideration. The other issue that I have fundamentally with Botox as my kind of go-to is just that Botox wears off. It's an invasive procedure. We do a camera into the bladder. which is well tolerated, but you can you basically you use a needle through the camera and you inject it directly into the bladder. And you have to do this every 5 to 6 months. It wears off every 5 to 6 months. And so for many patients, it is not practical to do a procedure every 5 to 6 months for the rest of their lives. I think that the other issue with Botox is that, again, it's a medical procedure every 6 months, invasive. And so rates of urinary tract infections with each procedure exist. These are low single-digit percents, but if you think about the aggregate effect of multiple injections over the course of your life, these are not small risks. I think that the other issue with Botox is that if Botox works too well, meaning that it relaxes your bladder too well, and we often don't know at the first visit how sensitive you will be to the medication, it can create a situation where you cannot eliminate the urine. And so patients not so infrequently need to catheterize themselves or have a catheter until the Botox wears off, if it works too well, until the appropriate dose can be found. I think the third bullet point here, where it says does not address the bladder and brain communication, though, is the key on this slide. Botox is basically working on the muscle of the bladder. From a scientific standpoint, though, we know that the real issue in overactive bladder is that this is a nerve-brain communication imbalance, and Botox doesn't address that. And you know, I think one of the benefits that we'll get to in kind of the InterStim technology is that it acts upstream of where the Botox goes in the muscle. And so we'll kind of get to that now. I just want to briefly touch on this because we listed this as a therapy that can certainly work, and for patients that are not candidates for the full-on InterStim, you know, kind of bladder stimulator that we put in the back. This is called the percutaneous tibial neuromodulation system, or the neuro system, as Medtronic markets it. This has a similar science to it to what the full-on bladder stimulator in the back gets to, but this works it works by stimulating a nerve in the leg. Kind of, you can see on the picture on the right side there that the woman there has a little lead going in, you know, into the skin to a nerve that kind of goes just next to the ankle, on the inner part of the ankle. And we stimulate a nerve right there that goes up the spinal cord that also kind of intercepts the bladder kind of brain communication. And this can be quite effective. It's certainly not as effective as the full-on bladder stimulator that we're going to get to in the next few slides, but it is less invasive. It can be done in the office. One of the drawbacks about it, though, is that it does need monthly maintenance sessions in order to give you long-term relief. At first, you come in every week for 12 straight weeks for 30 minutes. We find this nerve that's not terribly stimulating at all. And then, you know, patients are given a quick 30-minute treatment, and then they're out the door. We do this for 12 weeks, and then monthly if the treatment worked. And there's certainly patients that I have in my practice for whom this has benefited, certainly older patients for whom general anesthesia eventually to get the permanent stimulator is not practical, and definitely something that I use in my armamentarium in the right patient. The bulk of what I really wanted to emphasize in this talk is on this slide, and this is the Medtronic InterStim system. This is what I'm referencing when I have said several times in this talk about, you know, the full-on bladder stimulator. What this is doing, and the way that I would kind of think about this, is that overactive bladder is fundamentally an imbalance of communication between the brain and the bladder. I would kind of think of it as there is a lot of noise in the electrical signal between the two. And so what this stimulator is designed to do is we find a little, using X-ray guidance, we numb up the back, and then we find a little area in the back where we know the bladder nerve is going under X-ray guidance, We put a little electrode in that spot, and then we permanently implant a battery pack kind of in the upper part of the buttocks that communicates with those electrodes. And this provides a constant signal to basically interrupt the noise that is coming along the electrical signal. And this has been shown to be enormously effective in modulating overactivity in the bladder and overactivity in the bladder with regards to incontinence, and certainly with regards to fecal incontinence, stool incontinence. You know, obviously this is more invasive, and it has slightly higher risk profile than just simply targeting a nerve in the leg, but absolutely effective. And I have many, many patients in my practice that have benefited from this, and this is why I felt strongly enough about this to give this talk today. I think the thing that I really like about this as a technology is that there's not many things in medicine that you get to try it before you buy it. And what I mean by that is just that we do this in the following fashion. When patients have failed first and second line therapies and they do not want to pursue the Botox or the peripheral nerve, the leg stimulation, we talk to them about simply performing a test to see if they are candidates for a permanent stimulator. And so the way that this works is that you come to one of our offices, and again, just like I told you, we numb up the back, we find the nerve under x-ray guidance, and that day you wear an externalized electrode. It's kind of nicely hidden. You can see in the picture on the right that kind of connects to a battery pack. You work with a Medtronic representative like Jackie, who's the host of this call, and they can deliver a set of programs where using the electrodes that we put in there, or the leads that we put in there. And then we see for the next week or so, or for the next 3 to 7 days, did you get the desired result? And if you have, and we kind of define that as greater than 50% improvement in symptoms, then the answer is very obvious. Then then we tend to encourage those folks to get the permanent stimulator. The benefit of this is that if it doesn't work, we pull out the leads and we move on to the next therapy or to therapies that we have not tried. I think that, again, just to emphasize, one of the beautiful things about this procedure is just that one can try it before they commit, to a permanent implant, which is just frankly not true of many of the things that we do in medicine. The obvious thing is that, in terms of selecting people, I think, we want to make sure we're doing this for the right people. Certainly I believe in this product, but I think it works well, and our data is so suggestive of success only because I think we select the right people. You are right for this if you, frankly, have significant overactive bladder symptoms, and if you have tried lifestyle, dietary, physical therapy-related changes and they haven't worked. Oral medications either can't work or they're not practically affordable or without the desired side effect profile. And if you just want to move on to more aggressive therapies, that can work. Realizing that the alternatives to these, again, are the Botox and the peripheral nerve stimulation that I mentioned on the prior slides. One of the things that I do want to emphasize is that success is quite high in these patients. And again, we define success as greater than 50% reduction with regards to bladder symptoms. So that has to do with number of urges per day, trips to the bathroom, and the severity of the incontinence, the leakage. Our data suggests that 84% of people who used it for bladder control experience long-term success. 89% of people using this for bowel-related control experience long-term success. And I think the Medtronic experience kind of speaks for itself. Over 400,000 people have had this done. And frankly, I will tell you just from my personal experience and my knowledge of the literature on this topic, this far exceeds success with regards to other therapies for this problem. But as I mentioned with the caveat that we should select the correct patients for this therapy who have kind of gone down the algorithm that I outlined before. And so with that, I appreciate this opportunity to do this. And I'd love to hear any questions that you all have. I think I just want to make a plug for the fact that my office has specifically dedicated time to keeping appointment slots for folks that are interested in this therapy because I feel so strongly about it. And that can easily be done via this QR code here. And so with that, I'll kind of turn it back over to Jackie, and I'm happy to answer any and all questions that you all have. Thank you very much.
First question is, how sure is the product and process?
One of the great things about, frankly, one of the great things about being a medical professional in the United States is that I have significant confidence in the products that come along the pipeline. And this is just not coming from me or from Medtronic. These products go through a very rigorous FDA approval process, and these products have been around for, Jackie, probably 3 decades at this point. I think that beyond that, the consensus bodies that I trust with regards to the American Urological Association, the European Urological Association, committees that talk about overactive bladder and tell us as urologists out in the community what we should be doing, they are the ones that conduct these studies, citing the enormous amount of efficacy and safety that exists. And the experience on this is vast. Like I said on the one side, there are 400,000 people walking around with these treatments with on the upwards of 90% success rate, both for bowel and bladder dysfunction. That is not true of most of the things that you are offered with regards to medical treatments, not just for overactive bladder and bowel dysfunction, but in medicine generally. And so I have the utmost confidence in all of these products.
Okay, and then is this a radical improvement to present fixes?
Yes, this is, I saw a patient today in my office that we did a test on Monday. And obviously you shouldn't live your life by what you see with one patient, but I'm just giving you an example. This patient was going to the bathroom probably every half an hour to hour, overnight 4 to 5 times. We had done the nerve stimulator test. He had actually presented to me today, 3 days later, because we were planning to remove those, assess his response, and go to the eventual permanent implant. And he was just requesting to keep it in over the weekend because I think he may have had some plans this weekend, and he just felt like it would help him kind of better attend to his social needs. It was that effective. Someone was willing to wear an external wire outside their back because the effect was so dramatic. And he showed me the log of how many times that he was going. Like I said, he was going every half an hour to every hour. He was at the point now where he could hold it to every 5 to 6 hours. So I would call that radical improvement. Importantly, I would not call anything that we do in this space a cure, because I think that the science still needs to be better understood as to potentially even further upstream causes of overactive bladder. But as good of a cure that could be had, and the duration that it lasts, I think this is the best one.
I have a question. Is it covered by insurance?
Absolutely. This is very mainstream. Insurance companies are very much used to processing claims for this product. Whether and how much you have to pay out of pocket certainly has to do specifically with, obviously your setup, your deductible, your plan. They often, and rightfully so, the insurance companies want us to make sure that we have addressed lifestyle changes, patients have tried medications and potential alternatives before we graduate to this. But it is absolutely covered by insurance.
If you have bowel problems, does it also work for that?
Yeah, that's a great question, and I apologize if I did not emphasize this clearly, but part of what I wanted to emphasize in this is that yes, the bowel and the bladder are very closely related from a neurologic standpoint. And just to be very granular about it, for those of you that have had back surgery, you kind of get a sense of what I'm talking about. But there are different spinal levels off the spinal cord. The ones that we're trying to target are the sacral levels, the S like Sam levels. The bowel and the bladder, we know, are innervated, meaning supplied by the nerves coming off of the sacral nerve 2, S2, through S4. And so we are trying to get this stimulator into S3, which absolutely has both broad effects on the bladder and the bowel. So much so that the data for bowel-related incontinence might even be superior to the data for bladder, but they're both quite good.
And then another question is, can I have an MRI if I get this implant?
That is a very important question, and the answer is yes. Medtronic has designed this system now so that they are MRI compatible. The older generation of these were not, which certainly posed problems when patients needed MRIs. But yes, the modern technique or the modern technology and device is MRI compatible.
Okay, perfect. And I think that is to close our questions. Just wanted to say thank you, Dr. Desai, for hosting this event with us tonight. It was very informative, and we're very grateful for your time. Everything we discussed tonight is relevant to many of you guys, and I know each of you are unique. So it would be beneficial to make an appointment with Dr. Desai or whoever your physician is so that you can talk to him about this therapy. And if you want to scan that QR code before we sign off and make sure you sign up for a priority appointment, you want to do that, okay? So thank you everyone tonight, and thank you, Dr. Desai.
Thank you all for making time for this and having me here. I very much appreciate it.